Hi guys, Dr. Joe Brown here. Thanks again for all your guys' support and emails here. Now, one of our specific questions was, what can you do, or what recommendations would you give for somebody who either has gallbladder problems, gallstones, or possibly has to go in for a surgery for gallstones because it's blocking the bile duct? Now, here's the answer to that question, is that if it is a severe situation and you have gallstones that are stuck in the gallbladder area that's blocking a duct specifically, it can be a very drastic and severe situation, and surgery is 9 times out of 10 going to be recommended. From a natural standpoint, here's things that I have used many times with different patients, and the patients never had to go through a gallbladder surgery. What you're going to want to do is you're going to want to go and get extra virgin olive oil. Buy a whole bottle of it. Then you're going to want to go to your local grocery store and you're going to want to get a big plastic bag full of lemons. And it's as simple as this, guys. You're going to take a glass about this big or so, and you're going to want to fill that whole glass, about half that glass or 3/4 of that glass, with olive oil. Okay, and again, make sure it's extra virgin olive oil. You're then going to cut a lemon in half, and you're going to squeeze that whole lemon into that half a glass worth of olive oil. Now, depending on how big the gallstones are and where they're at, whether they're blocking ducts, things like this, you may or may not need to do more or less. So let's say you don't have gallstones in the ducts, but you know that you have them because maybe you went in and did an ultrasound and it shows that you have gallstones there. What I'd recommend that you do is you're going to want to do about 5 tablespoons to about a half a glass of olive oil with a good half of lemon, fresh lemon, squeezed in there, and you're going to want to drink that twice a day, morning and night. Okay? After you do that for 2 or 3, 4 days, you might get loose stools. Don't worry about it. It'll go away as soon as you stop the olive oil and lemon. Okay? Now let's say, for example, I had a couple emails on this where they actually have some pretty good sized gallstones, and a couple of them are actually close to some of those duct areas. You're going to want to do a good half to 3/4 of the glass of olive oil, and you're going to want to squeeze a good half a lemon, if not a whole lemon, into that glass. You're going to want to drink that about 3 to 5 times a day. You're going to want to do that for about 2 to 3 weeks. Then you're going to want to go back in and get an ultrasound done to make sure that those gallstones are reducing. Now here's the caveat with this. If you're having any drastic pain, any sharp pain, or you just came out of the hospital and your doctor says he's going to be putting you in for surgery, you need to make sure that those gallstones are not blocking one of those ducts, because otherwise you can have a severe situation. So again, this is something that you want to do sooner than later. You don't want to wait till the very end to try to attempt this, okay? And here's something else, and I'll just kind of leave this video with this, is that if you want to remember the 4 F's. If you're female, if you're 40 years or 50 years old, if you have flatulence, you're more likely to have gallstones, okay? So again, female, flatulence, 40 or 50 years old, you're more prone to have gallstones than if you're a man or if you're earlier in age, things like this. So if you fit that 4F category, you want to make sure that you're going in and getting an ultrasound if you're having any kind of pains over the gallbladder. But again, very simple. 4 to 5 tablespoons of olive oil, half a thing of lemon if you're kind of in that preventative stage, or if you're already at that point where you're having a bunch of gallstones, you want to increase the olive oil, increase the lemon. You want to do it for 3 to 4 or 5 times a day. Again, you are going to get some loose stools or diarrhea as you continue to do this, but don't worry about it. Keep doing it until you go back in and your gallstones will most likely reduce in size next time you get in for an ultrasound. So again, I'm Dr. Joe Brown. I just wanted to answer that question. It's a very simple, cheap fix. And again, thanks for all the support. Thanks, guys.